of all, thank you, Peter, for giving me the opportunity to be here today with you, everyone. My name is Olivier Defawe. I am a director of health system at VillageReach and also the program lead for the Drone for Health program. Just very briefly, VillageReach is a non-profit organization based in Seattle and with country offices in Malawi, Mozambique, and the Democratic Republic of Congo. At VillageReach, we aim to make health products available when and where they are needed. And we do that by developing, testing, and refining innovations, and scaling and replicating only the ones that have shown impact. And by innovations, we not only include technology, but we also include policies, procedures, training, etc. And since 2015, VillageReach has been active in exploring the use of drone technology to transport life-saving products. And you have a sample of here where we've been working and also still working. The various disruptions, economic, public disruption for the pandemic, has forced us to rethink how we do things and has resulted in a boom of innovations. For example, looking at telemedicine as a practice to adopt social distance practices, the number of telehealth visits in March increased of 154% compared with the same period in 2019. And also look at the vaccine manufacturer who speed up a 4+ years timeline to develop, test, and produce a new vaccine to literally less than a year. Well, the drone industry has also been positively affected. And recently the FAA painted a rosy picture of a clear sky for drone growth, reporting that the US industry is at an inflection point, demonstrating a powerful stage of growth. In the face of global COVID-19 pandemic, there have been reported attempts to utilize, many reported attempts to utilize drone technology in different scenarios. But for the most part, this drone utilization were mainly sporadic and not at scale. We can identify two main objectives that these different applications are trying to achieve. The first one is to help contain the spread of the virus, and that is where drones are used to monitor people movement, reinforce the lockdown and the curfew orders like we've seen in Sierra Leone, Rwanda, but even in India, Italy, and many other countries. These applications are expected to reduce the possibility to having first responders having direct contact with potential infected people. Some academic group also started expanding drone to conduct symptoms tracing that is enabled by thermal imaging and AI. While crowd monitoring remains the most widespread application during the pandemic, this application is controversial due to potential abuse to civil rights. Another key application that helps contain the spread of the virus is the transport of products, which include the picking up of lab sample and the transport and the delivery of supplies. And this application is a primary topic of my presentation today, but before I dig into some details, I want to mention that the secondary objective of that the drone industry is trying to achieve during the pandemic crisis is to keep critical infrastructure running under lockdown conditions that include inspecting infrastructure to ensure energy supply and communication network are up and running. Another application that has been boosted by the pandemic is the use of drone for surveying construction sites, for example. In fact, functions such as surveying saw as much as a 90% increase in use since the beginning of the pandemic. But let's focus on the drone delivery application. So prior to the pandemic, there were already a growing interest in using drone technology to transport goods, mainly for transporting medical products, but also food, drinks, and small recreational supplies, as seen in Australia, in the UK, and many other countries. Drone delivery presents many value, and especially in semi-urban environment and in low and middle income countries. And when considering supply chain, for example, the drone has an amazing potential to reduce transport time and optimize last mile delivery. Thus far, more than 18 countries have deployed drone for delivery and transportation and for transportation purposes during the COVID-19 pandemic. And I encourage you to check out the drone delivery database recently launched by VillageReach through the UAV for Payload Delivery Working Group portal. You have the address right here. Some of these deployments were just experimental and test, like what we've done at VillageReach recently in Mozambique, where we partner with the government of Mozambique and the National Institute of Health to conduct a study that aims at testing the integration of drone transport into the existing lab sample transport system. And so over those 4 days, we were able to demonstrate the safety, the feasibility of complementing and not replacing the existing land-based transport with drone, which allowed to speed up the diagnosis of COVID-19, of TB, and the start of treatment of various diseases. This study was planned before the COVID outbreak, but we were able to adapt its implementation to include the transport of PPE and COVID sample. So while this study it's a short study, its timing was important as the country is currently preparing for the distribution of the future COVID vaccine. And this study helped demonstrate that drone could be leveraged to distribute this important vaccine and ensure a more equitable access to the vaccine. Other deployments have been able to maintain regular drone delivery operation, like for example, in Rwanda and Ghana with Zipline, and in Malawi with Swooper. Well, it is all because in those 3 countries, drone operation already existed prior the pandemic. And drone operations were adapted in all these countries in order to respond to the increased demand of medical commodities, and in this case, the COVID-19 supplies, commodity supplies. In southern Malawi, there's a struggle to maintain consistent and reliable medical delivery due to a lack of road infrastructure and yearly flooding season. Well, since January, drones have been integrated into the health supply chain to deliver medical supply to 38 health facilities. And it is because Swooper delivery system was already established that the government was able to adapt the delivery to include PPE and COVID sample transport. And to date, Swooper has transported product for approximately 11,000 people per month, over 1,300 doses of vaccine, and over 1,600 face masks and laboratory samples, as you can see. The benefit that drone delivery offer in the context of COVID pandemic are the speed of delivery, the extended transportation network to reach the last mile, limited infrastructure contact, and reduced risk of transmission during the delivery. But only countries that already had the foundational enabling environment prior to the pandemic were able to add drone as an additional mode of transportation into their supply chain and sustain the drone delivery operation. Every use case is context and problem specific, and therefore potential benefits and impact of using drone for transporting goods cannot be generalized and require thoughtful understanding of the problem and the associated system in any given country context. For example, would a decrease of transportation time from 20 minutes to 6 minutes really impactful, considering that the current turnaround time for laboratory to test COVID is between 12 hours and 72 hours? While the 70% decrease in transportation time is an incremental improvement, relatively speaking, it does not provide sufficient evidence for impact, and therefore it is probably not the right use case for drone delivery system to be put in place. But on the other hand, in the context of Ghana, for example, where zipline drone operations significantly shorten the turnaround time for diagnosis for hard to reach area, there, in that specific context, the use of drone has a maximum benefit and significant impact that justify the level of investment that drone delivery requires. Another factor that impacts the uptake of drone delivery during the pandemic is the presence of a drone conductive ecosystem. Drones are more than just a plane. They are that you buy and fly. It is a system that needs to be put in place in order to safely, reliably, and sustainably operate a drone delivery service. These enabling subsystem elements include the regulation, the capacity, the skills to operate a drone hub, to integrate drone into local air traffic management. It is the public and the political acceptance, etc. And in Rwanda, Ghana, and Malawi, all the subsystem elements were either already there or on their way to be developed and implemented. The government were already convinced of the transformative value that drone can bring to their countries and their communities, and already invested significant amount of time and resources to develop the enabling environment. Over the last 20 years, VillageReach has managed this kind of system level change, and it took us months, if not years, to build this drone delivery ecosystem in Malawi, Mozambique, and DR Congo, DR Congo, and we're doing it again in Central African Republic. Since the beginning of the pandemic, many decision frameworks have been created by various organizations. You have example here, and this framework help and provide step-by-step guidance for government and implementing partners to determine if drone makes sense in a specific context and a pathway for the utilization of drone during a pandemic. While drone delivery offer many potential to speed up delivery, extend transportation network, and reduce risk of transmission in a context of pandemic, drone delivery requires the system and it is its subsystem element to be into place before you can actually say all systems are go and take off. But you don't do that in a matter of days or even weeks. It takes months, years to develop that enabling in drone conducive environment. The COVID-19 pandemic has spurred a burst of technological innovation and triggered the growth of the drone technology and its application. Government and various agencies have taken many extraordinary measures to allow many new applications of the drone technology, and some of them have proven sufficiently useful for them probably to remain after the COVID pandemic. However, new ways of using drone present new challenges. Issue of data privacy, legal and ethical concern related to law enforcement's use of drone, for example. US integration into the urban environment. Drone operator certification, and ensuring that new UAS business model are accounted properly within existing business regulation, all demand consideration. I want to close by just, if you are interested to learning more about what's been done around the use of drone for delivery, specifically for delivery, I encourage you to join and to check out the webpage and all the resources on the UAV for payload delivery working group here. That regroup on a quarterly basis, organize webinars, thematic webinars, have a library of resource available with tools, framework, but also just reports and experience, because the primary objective of that working group is to enable everyone and accelerate the development of drone for delivery and try to share as much as possible between the different group to really leverage each other and really accelerate the drone delivery space. Thank you very much.